You want to restart the video?
Yeah, it's recording.
Okay. So this was a patient with a sort of some variant of polycystic kidney disease. A young woman, she had all these cysts in her kidneys. She was having excruciating left flank pain to the point where she couldn't work. It was like 9 out of 10. So we got a request to do a sclerotherapy of this renal cyst here in the left kidney, or right kidney, which we've turned her right side up here. I was very skeptical. It wasn't a very big cyst, and I wasn't sure that this could be possibly causing severe left flank pain. But I basically do whatever. And so I went around, and every time this happens where they order a sclerotherapy, I have to like ask my colleagues what to do. So you can do it in the liver or the kidneys. And some people use ethanol, and some people use, you can use a lot of different agents, but I was advised to use doxycycline because it's a little bit less painful than ethanol. But most IR people and most papers actually say to use 99% ethanol. So basically what you do is you stick a needle in your lesion. So we get our needle into the cyst. And then we put a wire into it. And then we put a 5 French catheter into the cyst. And then we aspirated off as much as we could. And then which was about 16 cc's. And then we instilled in 16 cc's of a doxycycline solution. And then we sent the patient to the PPCA, and we had them lie on different sides of their body for 15 minutes each to rotate the doxycycline around the cyst. And then we aspirated it off and removed the catheter. And the patient now says she has 0 out of 10 pain and is going back to work. So wow. I have an N of 1 that this works. But in the literature, I found some papers that said it's actually quite successful. So if you have a cyst, you can't just aspirate it off. You want to sclerose it. Otherwise, it'll definitely recur. And so you can use these different agents. The one advantage of doxycycline is that it's both sclerosing and it's an antibiotic. Another thing that we could have done, I felt pretty confident that this was just a cyst. But another thing that people do is before they do anything, like once their needle is in, you might want to inject dilute contrast to make sure that it's not communicating with the collecting system, a vessel, or anything else like the peritoneal cavity. If it's, for example, if you instill alcohol and then it goes into a blood vessel, that could raise their blood alcohol levels. And there's actually a whole bunch of papers that have measured that and said like, it's usually okay, but whatever. And if you put alcohol into the collecting system, you can sclerose off the entire collecting system and kill off the kidney. So that is one reason to instill some dilute contrast before you sclerose something. Yeah.
So did they think it was the superior pole one only because she was having right upper quadrant pain? That was the closest to the liver capsule?
I don't know. We basically just went for the biggest one in that right kidney because she was having severe right flank pain.